Think about a scenario in your healthcare office. Let's use an actual scenario of an electrical outage and one in which the backup generator fails. All of a sudden, there are darkened rooms in which patients and staff may become frightened. There may be serious safety concerns. The physician cannot see to complete an exam. The digital phone system goes down without electricity. Computers will not work. Other electronic equipment will not work, which renders no access to electronic health records, diagnostics, pathology, and other things necessary for patient care. Let's suppose the medical office assistant were ready to administer vaccines and dispense those to the nursing staff, yet the refrigerator cannot be opened because of the power loss. Chaos follows. So, to use the systems thinking approach, begin by drawing a diagram. Why a diagram? Systems thinkers work from a central premise. We need to know how we are producing certain outcomes in order to produce better outcomes. Does this sound obvious? Perhaps so, yet in complex systems and in complex scenarios, this is not as easy as it might seem. We tend to make decisions within our organizations as if we know what implications our actions will really have. And to make matters worse is to take action without the benefit of a diagram that shows us the independent parts of our system and the interdependent parts of our system. Without that, we do not have the proper tools to conduct the operation successfully. Thus, an important proactive first step is to draw a diagram of reinforcing and balancing processes in the system to figure out how feedback will generate the behavior we want to change. Causal loop mapping and the use of other scientific tools are especially powerful when done in a team, because sharing of understanding can help us to gain a fuller picture of reality so that we arrive at more powerful action plans. What, for example, could be done to prepare staff for the actual scenario of an electrical outage? Some scientific tools of a systems thinker can be compared with diagnostic tools that are used in healthcare. For example, look at the connection circles or the iceberg, causal loops. How might these tools help a systems thinker visualize what is happening and the interconnectedness of that to arrive at potential solutions? Please take a moment to pause this video if you would like more time to reflect. The use of scientific tools in systems thinking can advance to logic models, such as the Kellogg logic model, to analyze and to bring about multiple potential solutions to complex scenarios. Let's summarize. Systems thinking is a lifelong practice, a transformational approach to visualize, think, learn, understand, analyze, and problem solve. It is a framework of methods and diagnostic tools that focus on the big picture versus individual parts as the context for defining and solving problems. Systems thinking requires sensitivity to the interdependent nature of the world in which we live, awareness of the role of structure in creating the conditions we face, a recognition that there are laws of systems operating that we are unaware of. It is the realization that there are consequences to our actions that we are oblivious to. Yet, systems thinking is not a panacea for all problems. It is not a specific collection of tips and tricks for teaching and learning. There is not a one-size-fits-all approach. Systems thinking is certainly not a blame culture, and it is not an intervention plan. Systems thinking can mean many things to different people. It requires curiosity, clarity, compassion, choice, and courage. The systems thinking approach includes the willingness to see a situation more fully, to recognize that we are interrelated, to acknowledge that there are often multiple interventions to a problem, and to champion interventions that may not be popular. We have discussed systems and complex systems in healthcare. We have used specific examples to explain systems thinking in healthcare. We covered a brief history. We talked about the disciplines that involve personal mastery, mental models, shared vision, team learning, and how these interlace with systems thinking. We have also talked about the science and scientific and diagnostic tools such as archetypes, loops, relationships, and how these can bring about visual models for solutions. Please take time to reflect on systems thinking and how it might apply in your individual life, in the world you live in, personally and professionally. Remember, systems thinking is a lifelong practice. If you would like further clarification about any of this, please use the box on the next page to contact me directly. Thank you.